Hello, welcome. What seems to be the problem today? Doctor, I have severe pain in my lower tooth. I can't eat or sleep.
Let me examine your tooth carefully.
The decay has reached the dental pulp. A root canal treatment is needed to save your tooth. Okay, doctor, please go ahead.
Now I'm placing a rubber dam to keep the tooth isolated and free from contamination. I'm removing the decay and creating a small opening to reach the infected pulp. Now I'm removing the infected pulp and bacteria from inside the tooth. I'm measuring each root canal to ensure accurate cleaning and filling. Now I'm cleaning and shaping the canals to remove all bacteria and infected tissue. The canals are now completely clean and dry. I'm sealing the canals with Gutta-percha to prevent infection. Now I'm restoring the tooth with a strong composite filling.
Thank you, doctor. My tooth feels so much better. You're welcome. Brush twice a day, floss regularly, and visit your dentist for routine checkups.